Hello, welcome to You and Your Health, a program sponsored by Dr. Save a Life Foundation. Today's edition is gonna be very sensitive and, as a matter of fact, so important to each and every one of us living in this country today. The subject of kidney has in the recent time been on the pages of newspaper, particularly with respect to the travail of one of us over there in UK. And on that very accord, it becomes important for you, please. Anything you are doing right now, do yourself, your family, this country a favor by getting to know certain things I will expose to you with respect to kidney-related problem. Of course, you can understand with me that in the recent time, the issue of kidney failure has been as though something is wrong somewhere. Yes, something is truly wrong. And I will be able to expose today, along with respect to that subject, how you will know whether you're already becoming a victim without knowing, and as well, how to be in position to manage this very condition. If you are planning to go abroad for kidney transplant, I want you to rethink by reason of what you will get today. I encourage you to call everyone you know right now to who come to this station. It's going to be a turning point to the health of many, to the frustration many people are passing through right now because of the issue of kidney failure. Do that, I'll be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health. I remain your friend, Dr. Richard Okoye, the president of Dr. Save a Life Foundation. We are going to look at a very sensitive subject today. Very sensitive, very important. As a matter of fact, something that has become the talk of the town. The issue of kidney failure, the issue of someone having a challenge with respect to the finding even an answer to it. So on this very day, we are going to look at the subject of kidney. A lot of people in this country today have kidney-related diseases. Even many of them do not know. But in terms of prevalence, even though we don't have a good statistics here, you can agree with me that many people are coming down with kidney-related problems. Why is it so common this time? What is really responsible? How do I know if I have it? And what will someone do in order to come out of it or to be able just to find a lasting solution? I will tell you today that kidney failure does not mean death sentence. You will see a number of people living in the same. And I earlier said, if you are making a plan to go abroad for kidney transplant, please rethink now. Just come to think about a man who is in the pain of a daughter having a kidney failure and also now suffering another travail by reason of finding an answer to the same. Taking a more reliable statistic from America, currently about 37 million people in America are living with kidney disease. Regrettably, as earlier mentioned, many do not even know. And why are they not knowing? Because in most times, there could be no symptom. Did you know that up to 90% of kidney function can be gone and the person will not feel anything? That's why it's as sensitive as what I'm presenting to you today. The reason why you should pay attention to know what you may never have the opportunity to get from your doctor. Now, let me first of all define this kidney, because our medical terminology so much turn a lot of things upside down that even when we are speaking, we assume that the people we are talking to understand it. I was talking to a man. When I look at his medical report, I discovered that the kidney, by reason of the report, is malfunctioning. And I was trying to explain to him about the renal function, the kidney-related problem. It was with his son. But when I looked at him, as we are communicating, I discovered there's a little gap, even when he will be nodding the head. And I asked him, I say, where is your kidney in your body? The man said to me, is it that one that is here? Oh, goodness me. That's when I knew we have a lot of work to do in this country. He asked me, is it that one that is here? And my heart wrecked. My heart wrecked in the sense that I realized that majority of what we doctors communicate to our patients, I assume they know nothing. And that's why today I want to talk about this subject in a common man's language. Very, very important. Don't assume you know. Please, you don't. The medical terminology has so been coded in a format that most times it's not available for a common man to understand. We are not assuming anything. Let's take it one by one. Now, the kidney is not here as that man assumed. I have to be in position to... The kidney is not in the tummy. It's not in the front of your tummy. No. The kidney is located where they call retroperitoneal. Retroperitoneal is that the peritoneum is where all those intestines and everything, when you open up here, you will see them. The kidney is located here. The kidney is located at the back here. If you look at this, you can see the location of this very kidney. The bean, like, if you see bean, just almost like that's the shape of the kidney. For some of us that also eat it. So you can have something like this. This is where the kidney is located. And what is the function of this very kidney? The kidney has what is called filters. Just like something you can filter, it has a lot of filters. Blood will get into the kidney. It will filter the blood from all the toxins you are taking, from all the things that the body excess water and all the things that are supposed to be troubling you. When it gets into here, the body, this very kidney, filters those ones that are supposed to be poisonous to the body. Then you could be in position to urinate it, to pass it away through the urine. All right. So this very organ is very, very important, and this organ should be well protected. Of course, you can agree with me that problem related to this subject is not poverty friendly. That's why as I'm talking to you today, you listen to me, because prevention of disease related to this is far better than the cure. Having been able to know the function of the kidney, at this very point in time, I want you to stay tuned. When I come back, we're going to talk about cardinal symptoms, about 10 classical symptoms. If you see this in your body, or if somebody else is telling you something, your mind should strike that this may be playing around the problem that is kidney related. All right? So stay tuned. Get more people to tune into this station right now, as we're going to discuss something that worth more than going for burial. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye.
My name is Mr. Taiwo Moses. I'm from Lagos. I had heart problem. My arteries, the 3 arteries were blocked. Since I had that, I could not breathe well. I cannot, a floor staircase, if I climb a floor, I will be panting. They took me to the theater, and the operation was a success. And here I am today. Even after the operation, I've gone downstairs through staircase now, and I've come up. So you can see the big difference. All the pains in the chest are gone. So I don't have any, the pain I used to experience, everything are gone now. I thank God, and I thank the Dr. Save Life Foundation for their support and for the laudable work they are doing.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health. I'll be your friend, Dr. Richard Okoye. And today we are talking about a subject that is very, very important. A subject that has been a recent concern to everyone, particularly referring to a man who had a challenge with the daughter. In the course of making the effort, it becomes sorrow upon sorrow over there out the country. And it's important we look at this very subject so that affliction will not rise again. And I said, if you are thinking of flying abroad for kidney transplant, I will want at the end of this message, you also will rethink. We're going to take this in stages today. What we're going to find out today, silent symptoms. A person may be suffering with respect to the kidney without knowing. I will also be in position to stage this very kidney problem in a format that you will know where you belong. And most importantly, I will also be able to put it to you that having a kidney-related challenge or kidney failure does not connote death sentence. A lot can be done and be done in this country excellently well, as I will reveal to you. Now let's look at the symptoms of kidney disease. But one thing you should note, as earlier mentioned, that 90% of the kidney function can go away, can die, without the person feeling symptoms. So what is the number one symptom? The number one symptom is that there may be no symptom. Whereas the kidney function is already gone down the line. And I will tell you how that can be staged so you have a better understanding of that. Now, for clinical manifestation, one thing that kidney problem present is what is called fatigue, tiredness, lack of energy. This very fellow that used to be, we now start having some level of tiredness. And when I say this kind of a thing, what does that connote? It also connotes that other things could be responsible. But we should not sweep it under the carpet. It probably will be something that has to do with heart failure or something that has to do with other causes of fatigue. But it could present with fatigue, one. Number two, a kidney disease may present with the issue that he find out that this very person will urinate and he discovered that the urine foams a lot like it's a beer that is actually dropping. And when you see such, it becomes important that you also be in position to ask more questions. Kidney-related problem can present with the issue of insomnia. This very person may be finding it difficult to sleep. It will be in position to start struggling with the sleep because a lot of toxins that are supposed to go out is now being trapped in the body. This very person will also present with what is called itchy skin. Alright? And that very itchy skin could be a telltale sign that something may also be going wrong in the kidney. Another symptom that could also happen is the symptom of leg swelling or ankle swelling. And he discovered that if you point the ankle may start going inside as if there is water inside. That could also present as a sign of a kidney being malfunctioned. There could be also what is called bad breath. Sometimes you find out that this very person, number one, may start losing appetite. He may not have the desire to eat. Sometimes he could also have something like metallic taste in the mouth. You start feeling as if there's the taste and the breath will be a little bit not as usual, but metallic in concern. That could be a sign that the kidney is having a little problem. It also will present with frequent urination. Because at the point of frequent urination, what it means that the kidney, otherwise who's supposed to absorb the water, is no longer getting enough reabsorb, so more will be pouring. So frequent urination could also be a telltale sign to a kidney problem. But you know what happened? Having mentioned all this, he discovered that they all in the same accord mimic other symptoms. Frequent urination, diabetes is there, insipidus is there, prostate is there, UTI is there, and all that. And so other symptoms also. So what does that connote right now? What it connotes is that it can present with a number of symptoms which when you go to the hospital poorly evaluated, it can be termed to one thing why the person is still dying. And that takes us to, how do I then know if I have kidney disease or not? Statistics in America show that 83% of Americans are at the risk of kidney disease. And 37 million people are already down with one kidney disease or the other. So, how do I know? And that brings us to the subject that has to do with the issue of the diagnosis. As earlier mentioned, it is the kidney that filters every blood that comes into it to be able to ensure that those that should go in, and those that should go out. Be that as it may, blood molecules, protein, albumin, they happen to be bigger enough that they can't be filtered out. Just like the hose that's supposed to allow things to go is tiny. But when you start having blood molecules, protein, albumin in the urine, it's an indication that this particular net may be tearing from somewhere. That very kidney may be having a concern. So when there is protein in the urine, irrespective of the outcome of the blood work, it could be that the kidney is having problem. And also a creatinine test, urea creatinine, the creatinine happen to be a product of muscle metabolism, okay? And it's a telltale sign. It's supposed to be, once it gets into the body, it should go out. But when there is certain level of this creatinine retained in the body, something is going wrong with respect to the kidney. And most importantly is what is called glomerular filtration rate, GFR. It is one of the things that group the kidney problem into 5 stages of kidney disease. The one is the glomerular filtration rate is more or less the milliliter, the quantity of blood that the kidney is able to filter in a minute. If he gets that done between 90 and 100, he said there's no problem. But why should it be a stage 1 when there is no problem? Because people that may have hydronephrosis, polycystic kidney, output syndrome may still be in position to look normal. So it becomes stage 1. Stage 2, go further than when it is between less than 90 or between 60 and less, when it is between 60 and less than 90 per minute. And when it goes to stage 3, that's where all those symptoms will start manifesting. And from stage 3 to stage 5, it's all dependent on the severity. When it's less than 15 mils per minute, then it means that this person has entered into chronic kidney failure, which may require an intervention. Stay tuned. When I come back, I will be in position to let us know the prevention, which will expose the actual causes of kidney disease, as well as is there any hope in this country with respect to this subject. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health, and today is a very, very important subject. We are looking at the issue that has to do with what? The kidney. And we've been able to talk about the function of the kidney, the symptoms of the kidney, how you'll be able just to get properly diagnosed of kidney problem. And now we're looking at the very important one to us, which has to do with the subject of prevention. How will I be in position to prevent kidney damage? Of course, this is the most important aspect of this very subject. We all admit the fact that kidney problem is not poverty friendly, all right? For which this aspect of prevention should matter very important to us. And to be able to know how do I prevent this, you first of all have to know the risk factors or the risk factor to kidney disease or kidney failure, as the case may be. So on that very accord, the commonest cause of kidney failure, the kidney damage in our environment, has to do with the issue of diabetes. Please listen to me. If you're diabetic, hypertensive, having hyperlipidemia, is important, please. You give all prevention to kidney disease by paying attention to those risk factors. Others include the lupus erythematosus, even HIV. When there is immunosuppression, you can suffer what is called HIV nephropathy, damage to that particular kidney. It could happen. Also, a situation you have kidney stones or frequent kidney infection. This could lead to the issue that has to do with failure. If you have prostate-related problem and you can't urinate well, my friend, is not a good thing. Because though urine retain, over time, if you get infected over and get the liver and get the kidneys infected, it may end up causing a damage to that very kidney. Now, yes, you can also know that young people this very period also tend to have kidney problem. There are ones that have a problem that's called polycystic kidney. Is also run in family. Such a thing is a telltale sign that if that kidney is not closely monitored, it can fail. Or being subjected to certain kind of drugs, being subjected to certain kind of habit or addiction. Young men today having problem of kidney because of abuse of tramadol. Those things could be in position to affect the kidney. And in the recent time, we all having today, somebody can come up with any product and say, if you drink this one, it watches your blood. You drink this one, it cleans up this, it cleans all that. And people are drinking without asking questions, nothing about the dose, nothing about what is this for. And people are drinking. When the liver can't handle it, we push it to the kidney. The kidney will pack up. We pack up. And don't forget, even when the kidney is damaging, it may not show. It may not show. So it is important that you be in position to take care of this your health by being mindful of what you drink. If you have diabetes, hypertension, please don't ignore it. It may lead to this kind of problem that is keeping our old man in the midst of pain. Now more pain, sorrow because of the issue of going outside the country for kidney transplant. Stay tuned. When I come back, I will show you a man living with kidney failure over 40 years. What is the secret? And what do you have to avoid? Or what do you need to do if you are thinking of going abroad for kidney transplant, even if it is your first degree relative? Are there things you should know here to avoid the saga or the pain a parent, in effort to save a daughter, happen to find themselves in it today? Stay tuned. I will be right back.
You and Your Health with Dr. Richard Okoye. You and Your Health with Dr. Richard Okoye.
Welcome back. We go further to the subject of the hope for kidney failure. Of course, we know quite well that when the kidney fails, somebody may have opportunity to live by doing what is called kidney replacement therapy. Kidney replacement therapy could be dialysis, and also could be the issue of kidney transplant. But here lies the hope. This man you are seeing had kidney failure over 40 years ago. Did I say something 40 or 4 years? 40 years ago, he had kidney failure. He's not living with his kidney. This man has been on dialysis for 40 years. Hear me. In the current dispensation, with the improvement on technology, if you get dialysis properly done, this very person can live out of death. So that people have kidney failure does not mean that the person is dead. No. We worked out a program that within a 3 months of dialysis, you will realize even when the kidney failure is there, that you are not dying again. So don't give impression to people that kidney failure is a life sentence. No. It is no longer true. So we are working out, being in position to give a hope to Africa, because it's more common among blacks, it's more common among Africa, even in America. All right. So we're working out dialysis that should be affordable and dialysis that should be in position to be able to do the proper cleansing and sustain the life until God favors such one for the possibility of kidney transplant. And if you are planning on kidney transplant abroad, it is important that you get this thing done. Even if it's your first relative that is going to donate the kidney for you, endeavor to have HLA typing done here in Nigeria. It can be done. So that if the person matches, before you start making an attempt to go, instead of going there and crisis upon crisis. But do you know what? If not for the ugly mentality that have caused us to reject our own, reject our country in search of order, kidney transplant can be excellently done in this particular country. All it will take is exchange of technology. Any doctor from anywhere can come in here, train the rest of others, and we have more nephrologists, have more urologists that can be in position to do excellent transplants. It's not a big deal. Kidney transplant technology is not a rocket science. No, I've been involved in this for years, more than 20 years as it were. It's not a rocket science. Excellently is done and is being done in this country. Why do we have to run up and down? In line with our vision of increasing Nigerian life expectancy 2025, we are also working out a modality. You have any question regarding the problem of kidney or kidney concern, make use of this very email here or the WhatsApp in send their very message. Professional advice from all over the world. We mobilize local, international nephrologists, urologists that could advise you. This we can't be suffering this kind of saga, humiliation, and all manner we can call it. Why those things can be practically be done in this country? What does it take? It takes us believing that this particular country can be great again. Please share this very knowledge to all you know, and join us to believe that kidney failure is not death sentence. A lot can be done about it. Not in the moon, not in the Mars, but here in Africa, in Nigeria. God bless you.